Today we have 3 new confirmed cases to report. One is linked to an existing case and the 2 others are under investigation still. In addition, we have reclassified what was previously a probable case as not a case. This means our total for confirmed cases is now 1,129, and this is the number we report to the World Health Organization. The total number of probable cases is 347, and our overall total is 1,476 cases. Pleased to say there are no further deaths to report today, and we currently have 7 people in hospital, none of whom are in intensive care. Of our cases, 1,201 are reported as recovered, and this represents an increase of 12, and 84% of all cases are now considered recovered. There are no additional cases within our clusters, and the total number of clusters that are of at least 10 cases or more remains at 16. Now, as we move back into level 3, routine healthcare is commencing again, and by this I'm talking about screening tests and childhood immunisation. And we have had some feedback from the sector that people may be misconstruing text reminders as being an error and the machine not having been turned off. These important preventive procedures are now back up and going, and I encourage everybody, if you do get a text, a phone call or a reminder about, for example, a childhood immunisation or a cervical smear, to please go and get that care. People should also not delay seeking care for acute conditions and even maintenance. If you have a chronic condition, please do get in touch with your practitioner, and as you will be aware, they can do many of those consultations virtually as well. If you get an appointment from the hospital for an X-ray or other investigation or an outpatient appointment, please do take up that invitation, and the hospital has very good procedures in place to keep you safe. A final update on the Section 70 notice. An amended Health Act order has been published on the Ministry of Health website. You will find it in the epidemic notices section on the Ministry of Health website. The new order amends the previous one to specify the following. People can travel to care for their pets and other animals because we know it's important to look after these important members of our households or wherever we're living. So we've clarified that veterinary services are permitted to be contact services, which means you can go into the premises to drop off pets or other animals that require care. And also, hunting of game birds for recreation purposes is not permitted at alert level 3. This means, for instance, people cannot go duck shooting and the like during alert level 3.
Roughly 75% of the economy is now operating. But as we've said, this extra activity does come with extra responsibility. The responsibility, as I've said repeatedly, to keep up that amazing effort that the team of 5 million has put in to fight the virus. So while people can now enjoy takeaways and pickups, it is vital that we keep our physical distancing and stay at home if there is no proper reason to be outdoors. Police have an online level 3 breach reporting tool via Police 105. As of 5:30 p.m. yesterday, 1,035 complaints have been received, with 277 referred to the compliance assessment team. Of those, 104 have been tasked with further action by agencies. Some are being followed up by MB, police, all dependent on the type of breach that may have occurred. The common themes of complaints were lack of social distancing, business breaches by patrons or staff, safe operating practices for cafes, recreational activities, and specific complaints about in-home gatherings. In addition, the all-of-government response team has a compliance centre that is monitoring the news that is being reported. So we're not waiting necessarily for a member of the public to make a complaint. If we see reporting through the news of compliance issues, then those are being followed up proactively as well. New figures also show the ongoing police response to enforcement, including a total of 185 breaches of the CDM or Health Acts under Alert Level 3. That's an increase of 81 in the past 24 hours. 46 prosecuted, an increase of 20. 119 warnings, it's an increase of 48, and 20 youth referrals. There are, of course, ongoing police assurance patrols, and over the course of the last 2 days, there have been 1,400 of those by the police. Police have also advised that after a bit of a spike in the first 24 hours of level 3, things have started to calm down, a similar pattern that we saw when we first moved into lockdown. So as I have said, we all have a responsibility to make this new phase of our COVID response work. Please continue to act like you have the virus when you are out and about, and if you see breaches, please report them. The last thing we can afford is a spike in cases due to taking our foot off the pedal. And as has been reported today, we do still have cases that are coming through, and so now is not the time to loosen up our compliance. Breakdown of how much of the wage subsidy has been paid to our smaller firms. More than $1.25 billion has been paid to about 188,000 sole traders. It has gone to 160,000 small businesses that employ between 1 and 19 staff, and almost 8,900 medium-sized enterprises, so up to 99 staff, have been paid $1.3 billion. Just as a reminder, people in receipt of that wage subsidy are those who can demonstrate hardship through Covid-19 and are required to pass all of that wage subsidy directly on to their staff members. It's one way that we have undoubtedly been able to limit the amount of job loss through this period. Many of our smaller Kiwi firms will be operating again under level 3, but they do still face tough times. So one thing I want to encourage everyone to do is to think about supporting local when you are engaging in contactless trade. This brings me finally to what is fast becoming a segment on Kiwi ingenuity. nzherald.co.nz is a website that contains business discounts for those working in our healthcare sector. It's playing two roles, though. Not only is it targeted at discounts for our healthcare workers, it's also targeted at businesses that may not be able to operate yet, be it accommodation or spa experiences or even elements of tourism. But as a way to thank healthcare workforces through significant discounts, whilst also helping some of those businesses prepare for the future world where they'll be able to reopen and operate. I do want to acknowledge Alika and Raul, who came up with the idea of Thank You Healthcare. Raul worked in New Zealand tourism industry for 25 years and was recently in hospital, and says, now is the time to show our appreciation for everything these incredible people do, not just in a time of crisis, but every single day. I couldn't agree more.